Welcome back, everybody, to another episode of Explain This. I'm excited to be in the Knoxville office today with Robin. We're doing another episode.
We are. I'm excited.
And this one is a very interesting topic.
Yeah.
And it's one that I feel like we don't talk a lot about because we talk about female infertility.
Yeah.
But today we're talking about male infertility and some things that we can do. Tell me a little bit about this.
Yeah. So I want to put the guys in the hot seat today because like you said, a lot of times all the focus goes on females.
Yeah.
So infertility is defined as an inability to conceive after 1 year of unprotected trying or 6 months if the female is over age 35.
6 months?
6 months,
okay.
over age 35.
Okay.
1 in 6 couples will face fertility issues whenever they are trying to conceive. In those cases, 50% of them are male factor.
Really?
Yes.
Interesting.
The woman always gets blamed for everything, but come on, guys, like it's you too. There is a 50-50 on this. So it's not always the woman. And that's what I kind of want to get out there is what the stats are on it and what we can do about it.
Are we saying that the women watching should share this with their significant others?
100%.
Yes. They need to
Tell
share
them
this.
it could be them too.
We're on your side.
And I think there's kind of a mental thing for men. I mean, it's a thing for women too, but I think for men, like that virility is like kind of their machismo, maybe. Like you don't want to ever think that you might not be fertile.
Right.
But you can be. 50% of the time, it's a guy issue. So big markers that we're looking at when we are looking at fertility in men, we're looking at sperm counts, we're looking at morphology, and we're looking at motility.
Okay.
So counts are how many sperm are there. Morphology is what do they look like, their size and shape. And then motility is can they move where they need to go. So normal counts, anything over 15 million per sample is considered to be normal. Anything below that, like if it's say 8, you're still fertile, but less likely to achieve a pregnancy. So there's a line there. Motility needs to be over 40%. That means that they can get where they need to go because some of them, they put them under a slide and they're just going in circles. That's not going to get them where they need to go. They need to go with direction. They need to have a purpose.
That's such a male thing.
I know, right? Just sit there like, whatever. And then again, morphology, looking at the size and shape of them. Are they formed correctly? Because if they're not going to accomplish the task either.
Yep.
So causes for decreased fertility. Tons of different reasons that this can happen. Some are modifiable, some are not. So one big thing, our world as a whole has become very toxic. It's a toxic environment that we live in. There's increased exposures to environmental endocrine disruptors like plastics, BPA, phthalates. These exposures start in utero. So when a mom is pregnant with a male fetus, anything that she's exposed to, obviously that baby's exposed to as well. So we are at the point in life that we are actually creating new life that is already compromised. We are already having lower testosterone levels to start out with, lower sperm counts to start out with because of the in utero exposure. Obviously, once you're born, nothing you can do about that. No. That falls on mom. But looking forward into the rest of life, getting away from all of those exposures as much as we can. There's a really interesting book if you want to dive deeper into this, and there's a Joe Rogan podcast on it with Dr. Shanna Swan. Her book is called The Countdown. And podcast with Joe Rogan, number 1638. It's a very interesting one.
Number 1638. I love it.
But her study has shown that from 1973 to 2019, the average sperm count dropped from 104 million down to 49 million.
Oh, wow.
Yes.
It's like over half.
Over half. And the phthalates is the big thing that she talks about, which we've done in another podcast. So it's those environmental exposures that are happening.
Yeah.
So that's huge. Other things, industrial chemicals, exposure to heavy metals, X-ray or radiation exposure. Obviously radiation, like in the confines of cancer, not a modifiable thing. Not something we can do anything about at that point. But if you work a job that you're around things like this, you need to try to stay away from it as much as possible. Obesity is a huge one. Being overweight definitely decreases sperm counts. Increased temperature in the testicles. So they need to be several degrees colder than the rest of the body. Every 1 degree rise in testicular temperature can decrease sperm quality by up to 40%.
Wow.
Yeah. So it's huge. Usually this results from wearing underwear that are too tight. So no tighty whities if you're trying to get pregnant. You need to let everything breathe. But also saunas and hot tubs, chronic use of those. We're keeping things too warm.
Or bad.
They're bad.
I might throw you off here, but what about cell phones in your pocket?
Oh, that's radiation.
Okay,
that's terrible.
Okay.
Not good either.
Okay.
Don't have it anywhere near anything.
Okay.
So those are all big things. A medical thing, a varicocele is something that can increase infertility or impair fertility. A varicocele is an enlargement of veins that are in the scrotum. It's due to defective valves. It's like a varicose vein, but in the scrotum.
Got it.
Usually there will be like a little bulge in the area, but that decreases blood flow that's going, so it decreases sperm counts, motility, and causes abnormal formation of sperm.
Interesting.
That's something that can be surgically fixed. A lot of times if they've got an unknown cause of infertility and they start diving down into the guy side of things, that's something that they find really commonly.
Really interesting.
So a quick little surgical procedure can turn that around. Infections. Epididymitis, orchitis, or different types of STDs like gonorrhea and HIV can all decrease fertility. There's something called retrograde ejaculation, which is where the semen actually goes back into the bladder instead of coming out. So obviously you can't get pregnant that way. It can be caused by diabetes, different surgeries. So any surgeries like on the prostate or anything like that can cause it. And there are certain medications that can do it too. Alpha blockers, which are medications we use for BPH, are really known for doing that.
There's a lot of things.
There's a lot of things. So I'm telling
Goodness.
you guys, it's 50-50. There's a lot. Hormonal imbalances. So testosterone, LH, FSH, thyroid hormones, adrenal hormones, all that plays a part in fertility as well. If we've got really low T levels, things like that can cause it too. Alcohol consumption, drug use. So drugs being steroids, even testosterone, or illegal steroid use. Marijuana. Marijuana slows everything down. Smoking anything. Stress, depression. And then hyperhomocystinemia, which we talked about in our MTHFR video. So you'll have to look at that one too. High homocysteine levels can actually result in damage in the DNA of the sperm. So we're not forming the right way. So what can we do about it? The good thing for men is that many of these risks are modifiable, and men are constantly creating new sperm. Women, we're born with the eggs that we have. If there's an issue with the eggs, so sorry, we're not getting new ones. They are what they are. Men, every 74 days, you have completely new sperm.
Wow.
So every single day, you're creating more. But it takes up to 74 days for them to actually be the ones that are coming out.
Got it.
So any changes that you're making, you need to make 2 to 3 months before you intend to either do the fertility testing or to be trying to get pregnant. Diet changes are really big. Eating organic, less processed, lots of fruits and veggies. Increase intake of nuts. Walnuts specifically have been shown to be very beneficial for fertility. Walnuts.
Huh.
Yeah. Lots of lean meats. So eating very healthy. And a lot of these are the same things that we're telling women to do before they get pregnant. So this needs to be a group effort. We got to be doing everything together.
Yeah, I often hear that, like when a woman's trying to get pregnant, they're making all these changes, and their question is like, does the guy need to be making changes too? And you think no, but because the woman is housing the baby.
Yeah.
But the man plays, obviously, a really
huge
big role.
Yeah. Well, and the man's contributing half of the DNA. So if you're doing something that's impairing the DNA that's going to be going into that sperm, that's going to be creating that child, you want the strongest DNA possible.
Now, go ahead and just, on camera here.
Okay.
As hopefully a future father, do I need to stop drinking caffeine?
Caffeine is a big one that does play into it.
Oh, come on, Robin.
Now,
not on camera.
Taking into account the time frames, caffeine is one of those very modifiable ones, just like alcohol.
Okay.
I would not tell someone, if you're planning to get pregnant 5 years down the road, stop drinking caffeine now. But when that becomes a discussion, I would say 3 to 6 months before trying to get pregnant is when men really need to start cleaning up their act too.
Interesting.
Yeah.
Okay.
Because again, you want
bad.
you want the best sperm. You want the strongest sperm. So clean things up so that you can have that.
Okay.
So again, if we're having active fertility issues, avoiding alcohol or significantly decreasing it, significantly decreasing caffeine intake.
Okay. Got it.
Increasing exercise. I said obesity was one of the risks, but even if you're at a normal body weight but you don't exercise, that can contribute to infertility. So we need to increase our exercise. Again, avoiding chemicals, those harmful exposures, anything like that. Wearing that loose-fitting underwear, checking and balancing those hormones, avoiding the drugs, avoiding the smoking, decreasing stress, improving sleep. Sleep is huge.
I have a quick question because
Okay.
I know it's very normal for the woman to go to a gynecologist and kind of they walk through this whole process. How do the men get checked? Is that a dumb question?
No, not at all. So it depends on what's going on.
Okay.
Not a lot of men go in and are like, hey, I'm wanting to try to get my wife pregnant. Check everything for me.
Right.
Women a lot of times go to the doctor. We have preconception counseling. We're going in and finding out, am I the healthiest that I need to be? Is there anything I need to change before I get pregnant?
Again, because you're looking at it as like the baby's going to grow inside you.
Exactly.
Right.
Men
Okay.
a lot of times are just like, yeah, whatever. I do my job and then I'm done.
Yeah.
If we are wanting to check things out, there's a couple of different ways to do it. Urologists, there are fertility specialized urologists that know how to do the semen analysis and things like that.
Okay.
Obviously, coming to someone like us because we know the blood tests and everything to run to look for that sort of thing. So we can see if there's a hormonal issue. We can counsel on all the other things. And then you can also go to fertility clinics to get a semen analysis. That's what's going to tell us what things look like. You do a semen analysis. It gives you your count, your motility, your morphology, all of that.
It gives you the information.
Gives you that information.
And then you can go to checking hormones, checking your diet,
Yeah.
and stuff like that.
And so some people will want to start with that. Like, hey, where's my starting point?
Yeah.
A lot of times it doesn't get to that point for men until they're at the infertility where they've been trying for 6 months to a year and not getting pregnant. So that part I want to change because that part's very frustrating for women. You're trying and you're trying and you're trying and you keep thinking, well, is this something that's on me? And 50% of the time it's something that can be on the men. So we can intervene early on and look at those sorts of things early on because it's easy to do. It's an easy test. Intervene, change things. It takes about 3 months for those changes to kick in and then it improves things.
I really hope a lot of men watch this episode, just to know that, there are some things you can do that
Absolutely.
can, increase chances. Because I know
And
it's a major cause of frustration
Yeah.
and anxiety and, especially as people are having kids later on in life.
And there's not as much information out there for men.
Yeah.
I've also compiled a list of supplements.
Yeah.
So there's a bunch of different supplements, but these are some of my favorites. D-aspartic acid, vitamin C, vitamin D, tribulus, fenugreek. Zinc is a really important one.
Yep.
Ashwagandha. Ashwagandha helps to reduce stress. Maca root is really good for improving hormone levels. CoQ10, a B complex, or a folate, because again, that hyperhomocystinemia can be in effect. Omega-3. And actually using LDN has been implicated in helping to increase fertility. We talk about LDN all the time. It is one of our favorite things. But again, LDN can help fertility as well.
Awesome.
And then medication-wise, if needed, HCG and Clomid are the two medications that we use to boost fertility in men.
HCG and Clomid?
And or.
And or
sometimes
Clomid.
Sometimes
Okay.
and, sometimes or.
Okay.
Yeah.
And I think, have we done an episode on HCG for testosterone?
I think we have.
Yeah.
We'll link to that one.
If we have, we'll link it down in the description below. Robin, have you explained this? I feel like you
I feel like I have.
Yeah. Has she explained it? If she hasn't, rewatch the video and send this to a friend who needs to see it. We need to get this information out there.
Mm-hmm. We
need to start taking some accountability, guys. There's plenty of things that you can do. Hopefully this helped you start here. Robin, thank you.
Absolutely.
It's been awesome. Guys, explain this. As always, we'll be back next time.
Don't go away.